Yeah.
Good afternoon, everyone. On this Saturday afternoon, I wish you everyone the happy Teachers Day because we all are the teachers in some other sense. We all are teaching, sharing our knowledge with each other. So, with this quote, I like to start this for today's session. Like, if you know the difference between your fingerprint and signature, because we are the forensic people, and usually we start our forensic learning with the fingerprint and the signature analysis. So if you are able to make your signature, means you are a literate. So it's complete dedication and complete, you know, uh, complete, dedication and the complete devotion of your teachers who expended their time. And we always be grateful all our teachers. And we wish happy Teachers Day to all the teachers of the world. Here, we welcome esteemed speaker, Dr. Hani Jahshan. He is going to speak on the impact of abuse on mental health and child development. He is a senior consultant forensic pathologist at Royal Medical Services, Bahrain Defense Force. Welcome, sir. Thank you for accepting our invitation. I, along with my co-host Priya, we welcome you on this international lecture series, and thank you once again for accepting our invitation and taking out time to deliver a lecture on very sensitive topic, that is mental health. I request my co-host Priya to take over the session and introduce our esteemed speaker.
Yes, sir. Uh, I would like to introduce Dr. Hani Jahshan to all the participants. He is a well-known forensic pathologist by profession. In 1992, he was appointed as a forensic consultant pathologist at National Institute of Forensic Medicine, Ministry of Health, Jordan, where he worked on various medical legal cases. Then in 1998, he was appointed as Chief Forensic Physician at the Family of Protection Directorate at the Public Security Department in Jordan and worked on cases of child abuse, domestic violence, and sexual violence. And from 2013 till present, he is working as Senior Consultant Forensic Pathologist at Royal Medicine Services, Bahrain Defense Force. Over a period of 26 years, he has performed over 8,500 postmortem examinations and clinically evaluated over 7,500 victims of sexual violence, child abuse, domestic violence, and several hundred cases of torture and other forms of violation of human rights. He is a man who is fully dedicated to forensic, medical, and scientific services. And the spirit of public duty as forensic scientist, he is serving people to live healthy life, both physically and mentally, in just safe and environment, both at family and society level.
Thank you so much
Now
for
I hand over the session to Dr. Hani Jahshan, sir. So you can continue with you.
Thank you, Priya, for nice introduction. I request Dr. Hani Jahshan to take over the session. Now the floor is yours, sir. Thank you for accepting our invitation.
Well, thank you. I am really glad to be with you. I want just to start my presentation. Okay, my presentation is going to be on impact of abuse on mental health and the child development. Uh, of course, you all know that child abuse is a serious problem in all countries of the world, and unfortunately, it is managed in responding to cases after it happens. It's the reality of this problem. Child abuse is a public health problem, and if we focus on the prevention of cases initially, then we'll not reach this bad consequences of child abuse. And one of the sentences which I never forget in one of the conferences, that if you spend $1 in prevention, you are saving $33 in responding to child abuse. Of course, money is not the only issue, but here we are talking about suffering of cases, disabilities, and even death. My definitions of abuse and all my background information regarding what's written in the literatures are the United Nations literature. As you can see, it is the World Report of the Violence and Health published in 2002, and the UN Study of Violence Against Children published in 2006. I was privileged to be one of the editorial board of this study, and the other references, as you can see, you can download them from the internet, or you can, if you go into my site, which I will going to provide at the end of the lectures, you can download any one of them. So why now? Every 5 minutes, a child is killed by violence. 400 million abandoned children lives on their own now. And probably those numbers 2 years ago, but we expect that these numbers may be a little bit higher now. The 26 million children aged 5 to 17 working in dangerous condition. 1 million children forced work in mines. And you know that working on mines is with, my voice is okay? Okay. 1.2 million children and babies are trafficked every year. At any one time across the world, around 1.8 million are being abused through prostitution, child pornography, and sex tourism. And as you know, sexual violence against children are the most destructive psychologically, which may accompany the child the rest of his life. 5.7 million slave children in forced labor, and 300,000 children are soldiers under the age of 15. Of course, we know that even under age 18 is not acceptable, but the number under age of 15, we are talking about 300,000 children. Why now again? The scale of violence is unacceptable in all countries, and I know I met professionals from your country, and they are facing the same issues as we face in Jordan and in Arab countries and all over the world. Violence causes severe physical, cognitive, and economic damage, which is the core of my lectures. Introductory cases, usually I just show some of the very old cases, maybe 15 years old cases, just to give a message. So the cases are old because to hide the identity. Anyway, the identity is hide. In one of the autopsies, I will show the pictures quickly because it is broadcasted, just in case. The case which we are going to see now is a child 14 years old commit suicide because he was verbally abused by his stepfather. It is typically in forensic pathology, hanging by himself usually is suicide, and in forensic pathology and the prosecutor general, the case is solved. The case was solved, but you look at his letter of suicide. He said, of course, it's written in Arabic. He cursed the society. All of you are dogs, and la ilaha illallah. And he asked for, you see, there is an eye with tears, but here it's written, take care of my sisters. Take care of my sisters. So here we are talking about a very serious emotional, which sometimes considered okay to curse children or to verbally abuse them culturally, but this verbal abuse ended by death. So when we are talking about consequences of child abuse, it's not only behavioral, social, or psychological, it may be death. This is one example of how child abuse lead to death. This is very clear what's written. Of course, the prosecutor and the forensics, they want to know, is it his handwriting or not? They proved that it is the same handwriting with his copybook, and he was able to write it on himself. And the case ended legally, but it did not end socially. Who will follow his sister that they are not abused by the same stepfather? Here we are talking about prevention. Is much more important than treating. If this child was discovered by a teacher or social worker or police, we will not see this terrible ending. Sometimes there will be no consequences at all. And this 6 months or 4 months child was sexually abused by a friend of the father in a really disgusting way. He put his genital organ in his mouth, and we collected evidence, and the specimen were positive for his seminal fluid. But of course, you expect in this case, you don't expect any consequences later on in his life. So we are talking about a variety of conditions in which physical abuse may be lethal, and sometimes, depending on the age of the child, you will not. There will be no consequences at all, and in between, you can imagine a very large area of condition that result as a consequences of a child abuse. Anyhow, of course, there is always a hope in the treating cases, but this is not the aim of my lecture. The aim of my lecture that we need to focus in the precipitating factors so we can prevent the consequences. We see child abuse at the United Nations main classification: physical, psychological, neglect, with the main classification. There is roots and there is consequences. If we just in the emergency room or the doctors deal with the main forms of violence, then we are not getting into the roots of the problem. We should look at the causes, risk factors, and the consequences. It is a continuum from roots, presentation, and consequences. One of the terrible cases of attention deficit disorders, he was treated badly with burns, with, you see the iron, because the parents think that there is evil spirit in him, but it was a typical case of attention deficit disorders. He came to our service in Amman, and he really improved. And you see a smile on his face after 2 years of suffering of abuse. So these consequences that he suffered psychologically and burns and scarring his body, sometimes, I say sometimes, because sometimes we cannot succeed to get rid of his problem. You see his smile here, an indication that we succeed in rehabilitating him. But many other children did not reach a service like our service, sometimes reach a service that we had in Jordan, and we failed to provide the treatment because the case is very difficult. So that's why we need to look at the roots, as I said just before, the presentation and the consequences. Here, another case which was really treated badly, and after 1.5 years, you see the smile on her face. This case, his penis was amputated by his mother or uncle. There is dispute about the incidents, and fortunately, we succeeded to treat him in Mayo Clinic in America, and they did reconstruction to him, as you can see. And after 5 years, you see his smile on his face. Of course, the abuse resulted in a permanent disability, the kind of functional disability, but we need just to confirm that if we provide good services, this is another success story. So why now? As in we saw in the first slide, there is a lot of statistics which indicate that this is a serious problem. You saw clinical cases in which we failed that ended in death, and you saw cases that we succeeded in rehabilitation. So I'm going to talk today about consequences which will be documented nicely, but at the same time, whatever consequences, I will go to the roots of violence that ended in this consequences. Just to unify our information, if you look into the internet or literature about definitions of child abuse, you will never end. You will find thousands and thousands of definitions, really. And we got really confused if you want just to compare those definitions. So my ABC in dealing with the child abuse regarding definitions is the definition of the United Nations, the WHO, UNICEF, and the Office of Human Rights are my reference, and I recommend this for any professional who are working in the field of the child abuse or even in violence in general. So I will go through the definitions. So me and you will unify our knowledge about what we mean by different terms of violence and child abuse. Violence as defined in, and this is one of the most important sentences in, if you work on violence, it costs the United Nations $3 million for this sentence. And I am not exaggerating because when we read
sorry to interrupt you, sir. Your voice is a bit low, so I humbly request you to just speak a bit loudly, sir, so audience can hear, sir. It's a humble request, sir.
Is it very low?
Yeah, so if you speak a bit loud, it will be more clear for the audience.
Okay. Definition of violence against children as defined by the WHO in 2002. This definition cost about $3 million in consultation preparing to publish the report on violence and health. And in the introductory page of this report, they concluded this definition. Violence is the intentional use of physical force or power, threatened or actual, against oneself, which is suicide, another person, or against a group of community, which is terrorism, and either result, here is a very important issue, which either results in or has a high likelihood of resulting of injury, death, psychological harm, maldevelopment, or deprivation. So this is one of the very basic ABC when we are dealing with violence. Of course, child abuse is violence, and the UN study of violence against children just make it simple for every professional in the world that violence is abuse and abuse is violence. Of course, if you are trying to look in literature, there is many people trying to distinguish between violence and abuse. But for the UN study of violence against children and for the United Nations organization, violence is abuse and abuse is violence. Just to make it simple to police officers, to doctors in clinics, and to doctors in emergency room, they don't need to distinguish between words violence and abuse. Probably some of you will not like this, but for a practical reason, I like it and it works very fine when you deal with daily cases. Violence against children, this is in 2006, and it is defined based on the previous definition of violence by WHO. When we are talking here violence against children, once again I reiterate that this is abuse. The intentional use of physical force or power, threatened or actual, against a child by an individual or a group that either result or has the high likelihood of resulting in actual or potential harm to the child health, survival, development, and dignity. Of course, we can go into each word of this for lectures and lectures about what we mean by violence, but I think just to simplify it, we are talking about healthy problems, death, development, and even dignity, the psychological consequences of abuse. And here, the basic issue in this definition that it result or might result. So, the violence is not considered about against child violence to cause an actual result. If it may cause the result, it is still under this definition. So the main definition of violence against children, then we go into psychological violence, any form of insult, name calling, ignoring, isolation, rejection, threats, emotional indifference, and marginalization that can harm to the child's psychological development and well-being. Neglect, and many people does not recognize neglect, unfortunately, as part of violence, but we got a little bit difficulty in introducing it in the definition of violence, and we succeeded. Neglect is violence, and this is accepted by the UN agency. The failure of the parents or carers to meet the child's physical, emotional needs when they have the means, knowledge, and access to service to do so, or failure to protect her or him from exposure to danger. Here we'll go into dialogue about the role of the government if in poor communities and in uneducated communities is this neglect or not. And we go into another dimension, which is the government neglect. But for the time being, not providing the basic needs of the child, to me, is the responsibility of the parent, and they should find their way to motivate the government to provide this need if they are in poor communities or in uneducated communities. The related forms of neglect, abandonment, dangerous and harmful hazardous work, deprivation, state neglect, and as you know, child labor is not a form of violence, but when a child working in a dangerous space, it is neglect, and he may be even sexually assaulted or physically assaulted by the owner of the work. So when we are talking about neglect in working hazards of children, we are talking about different forms, not only neglect. Physical violence is the intentional use of physical force against a child that's either result in or has a high likelihood to resulting in harm to the child health, survival, development, and dignity. When we come here, we got corporal punishment, which is of course one of the worst, to me, is worst form of punishment of children, judicial use of physical punishment and torture, especially judicial use in the child institution. For I don't know if it's true or not. We are getting a lot of clips on Instagram, Facebook, and YouTube about the Indian police punishing those who are violating the guaranteeing not going to the streets by beating them by stick. and a lot of fun about it. I am not sure if it is true or not, but it is, as it is in your culture, it is accepted corporal punishment. In our culture, it's also it is accepted to punish children by stick or by slapping them on face. This is violence, not accepted, and we should be able to change it. Sexual violence is any sexual act, attempt, or to obtain a sexual act or other act directed against the person's sexuality using coercion by any person, regardless of their relationship to the victim in any setting. Here we are talking about sexual abuse if it happened from an acquaintance in a family or even from a stranger. It's classified under abuse. There is many different forms of sexual violence. Recently, with the excessive use of the internet, there is a child pornography, child prostitution, and child trafficking, and even sexual violence related towards all these forms are really very difficult to deal with, and it needs public health project, not only a child protection service. When we go back to the UN study of violence against children, it differentiated the different settings, violence against children at home, and schools, at institution, at workplace, and in the community. Of course, as you might expect, the most difficult forms to deal with violence against children is this one, an institution, because it is hidden behind high walls and very difficult to get to those children. They are abused from the worker in those institutions in many different ways, and the worst form of that is sexual abuse. Of course, statistically, violence at home and violence at school are more statistically, but violence against institution is really bad because it is hidden and no easy access to it. Violence against working children is a phenomenon different from child labor, and we should distinguish between them. We need a project to deal with child labor, and at the same time, we need a project to protect children from sexual violence, physical abuse, and neglect from the family who are working in those places. Violence in the community also, we are talking about gang, drug abuse, internet violence is classified here and here, crossing item to different settings, and also a challenging program. Now we are talking about the implication, the consequences. I just provided a background for different definitions, so we can talk at the same tone without confusing. Once again, my reference is the UN definition of violence and abuse. So what are the consequences and the implication of child abuse? I just went from the birth of the child to the death of the person. We are talking about a very important study, which the ACE study, or ACE study, which is abbreviation of Adverse Childhood Experiences. It is a well-known study. It started by now maybe 20 years. It has a reference and even a website, I think. You can get it from here. It is the largest ongoing examination of the correlation between childhood maltreatment and health and well-being of outcomes, not only for children, for adults. When the first time I heard the presentation about it, maybe 20 years ago, I could not believe it. I said, what's the nonsense talk? We are talking about my diabetes and my liver failure and my lung cancer is related to child abuse. This is stupidity. That was my initial response to the study, but after this presentation, or if you came across this study, the ACE study, you will believe that many of our cases as adults, we are seeing consequences. We are seeing in clinics, emergency room, is related to child abuse based on the adverse childhood experiences. Data are collected. This is the initial study from 17,000 participants, and I am glad that our colleagues are doing the same study in Saudi Arabia. I think finding shows that certain experiences are risk factors, causes of various illnesses and poor health. Once again, not only for children, but even for the adult. Just please don't forget this slide for the rest of this presentation. And if you go across the study, you will need to remember this as the ABC of the ACE study. When we are talking here, we have 10 items. One score was given to one of these items: psychological abuse by parent, physical abuse by parent, sexual assault or abuse by anybody. This is one score, one score, one score. Then we come to neglect, emotional neglect and physical neglect. One score for each of them. Probably sometimes even who are not clinicians, they cannot probably not distinguish between physical neglect and physical abuse, and they cannot differentiate between emotional abuse. When we are, of course, we can into definition of all of them, but we don't have time because they are different categories. We are talking about emotional neglect, so that withdraw the life of the child and you just don't communicate with him. This is emotional neglect. Household dynamic by category. Alcoholism, drug abuse is one. Loss of biological parent at the age of 18 or less of the child. Depression or mental imprisoned household. So just to get it visually, we have three categories of risk factors of ACE study. The abuse, which is physical, psychological, sexual. The neglect, physical, emotional. Household dysfunction, if one of the parents are drug addicts or alcohol addicts. Loss of biological parent, and if the child is under 18, if there is mental illness in the family, if there is violence against mother of the child, or house of abuser, or if there is imprisoned person. So there is one score for of these, and all the study are based on the score of the previous history of the child in his childhood, how much he accumulated number of scores of this 10 scores. And this is the link of the study. I will put the presentation on my website, and I will put my website at the end of the presentation so you can go back and look at the study carefully. The introduction of the ACE study is child abuse and neglect affect children, adolescents, adults, and society. And this is the core issue of my presentation. The consequences of the child abuse that the child faces in his childhood is not limited to his childhood. It will affect his adolescence, even when he became adult, and even will affect the whole society, which is going to be the last presentation of the last slide of this presentation. The effect of child abuse in children vary depending upon the circumstances of abuse, personal characteristic of the child's environment, and these consequences. And of course, we can go into the details of this, and we'll take a lot of chance. For example, if the child, there is in the child environment a protective factor, like a protective mother and the father is abuser, so this environment will not affect this child compared to another child who is a child of a single mother who is abusing him. So if there is a protective factor in the family, the consequences will be less. The characteristic of the child, this is studied extensively, and probably the most clear example, disabled children, the children with attention deficit disorders or autism are more susceptible to abuse than other. And it is a long list, but this is not the place to go through them. We are talking about mainly consequences. So the consequences, main classification of consequences are physical, psychological, behavioral, social, or any combination of of all these. They could be mild or severe, disappear after a short period of time, or last a lifetime. A very clear example of last of time of consequences of a child abuse is sexual abuse of children, mainly females, that may affect their psychology the rest of their life, whatever services we provide to them. Not all children are will experience a long-term consequences, but they have increased susceptibility for those consequences. Factors affecting the consequences of child abuse and neglect, individual outcome vary widely and are affected by a combination of following factors: the child age, development status, when the abuse or neglect occurred, the type of maltreatment, physical abuse, neglect, sexual abuse. Each one of them has different effect on the child, the frequency, duration, severity of maltreatment, and this is very obvious. If the abuse is frequent over years, if lasted for many years, if it is severe, we expect that the consequences will be more clear. The relationship between the child and the perpetrator. If there is attachment, or like mother or father are abusing the child, we expect that the consequences will be more severe than if the abuse from a teacher or a stranger, in which the attachment relationship between the abuser and the abused are not very well established. So if we apply this, the worst form of consequences of abuse in children in adulthood life will be sexual violence if happened from a father on a daughter, because there is a relationship, and it will be more severe if it is more frequent and it includes vaginal penetration, for example. So when we expect the consequences of violence in the adult part of the life, we should consider these variables in account. Child resilience is a very complex topic, but simply I tried to translate it in Arabic and I failed. What is child resilience in Arabic? But it is a mixture in both risk and the protective factors that cause the child positive or negative reaction to adverse experience, mainly positive. Some children will not be affected of abuse with no consequences, we say, because he is resilient. The ACE study and many other research confirms that it is not genetic. The resilience of the child that can hit between two brackets to protect himself, it is by culture and the way he is raised in the family. If there is a positive attachment, if there is self-esteem, if he is intelligent, if he can regulate his emotion, if he has sense of humor, and if he is independent on himself, we expect that he got a high resilience index, if we can say. But the studies shows that children are very, very much of their resilience and combating violence by themselves. As I mentioned, it depends on those factors I just listed. The consequences are interrelated. Physical consequences such as damage to the child's growth, the brain can have a psychological implication. Psychological problem manifests itself by physical illness, which could be depression, high risk behavior, and I will go through them when we talk about psychological consequences. Social consequences are a public health issue, increased cost of healthcare, human services, and educational system. Child abuse and neglect can serious impact on the society as a whole. Therefore, it is imperative of communities to provide a framework of prevention strategies and services, be prepared to offer treatment rehabilitation when necessary. So we are talking about prevention and not only response. As I show in the introductory cases, when child abuse happens, usually some part of the child physical, psychological, behavioral structure of the child is destroyed. So we are supposed to focus on prevention, not only in providing rehabilitation. When we are talking about neurophysiology, when the child are expected to unstress, they will be released of a complex neurochemical and hormonal system. If this became chronic, we are affecting the psychological status of the child. Of course, any human being if subjected to stress, these hormones in red will be released, and this is normal physiology. But if it is repeated and became chronically released, as it happens in chronic physical abuse, then this has a direct effect on the psychological consequences. Of course, when we are talking about shaken baby syndrome, there will be destruction. It is vary in severity from death to simple concussion. And in this case specifically, it ended by a shunt from the cerebrospinal fluid to the abdomen, which need to be changed every 3 or 4 years, I think. But the most important thing is not the medical condition of the child. The brain damage of this child is related to his failure to develop with low statures, inability with loss of cognitive abilities, and even with emotional reactions. All of these are related to the initial insult done to the brain. Even one of the courageous studies which says that shaken baby syndrome that are very minimal, which are not seen in the emergency room, it is the main reason responsible for early learning disabilities at the age of going to school. Of course, you can debate this article easily, but to me it's logical. When you shake a child, you will have petechial hemorrhages in the brain. He will go into temporary loss of consciousness. He will awake after 1 or 2 hours, but the damage is there, and it will not appear for this infant except when he start to go to school or when he start to speak. So the shaken baby syndrome and physical injury to the brain is really one of the main causes of consequences to the child, either developmental, behavioral, or cognitive. Physical health consequences. Please remember the scores which I mentioned, the 10 scores that this study are using. One of the simple sentences of this study state that immediate physical effect can be relatively minor, bruises or cuts, or severe broken bone, hemorrhages, or even death. Any professional working in or any police officer working in the emergency room, he can realize this, that physical abuse can be simple bruises or broken bones. Usually the physical effects are temporal, but the pain and suffering are associated with abuse is really sometimes could be permanent. Child abuse and neglect can be a multitudinal long-term effect. And this study, which is really need to be considered very importantly in this presentation, research found that at some point during the 3 years followed a maltreatment investigation, 28% of children have a chronic condition. Of course, I know in our culture and probably in India, we just see the child abuse in the emergency room or in child protective service. We treat his fracture, we treat his even skull fractures or simple bruises, and we never follow on their health condition. And this study followed in their health condition, 28% of children who had chronic 28% who had abuse have a chronic health condition, and this is really very serious. And these studies can be done easily. Just provide a social worker who follow any case seen in emergency room or child protective services and follow a health record after years. This is an initial result of the study. Of course, when we are talking about brain development, I just mentioned it, that the physical injury of the brain will result in a long-term consequences. Those are very important results. Important regions in the brain to fail to form or grow properly, resulting in impaired development. Here we are talking about brain injuries in childhood that result in a long-term effect. These alterations in brain maturation have a long-term consequences in cognitive, language, academic abilities, and are connected to our mental health conditions. So when the neurosurgeon treating the child in this case of subdural hematoma, and he evacuated the trauma, his work did not finish, for God's sake. The consequences of cognitive, language, academic, and mental are there and should be followed up. Unfortunately, with my when neurosurgeon I came across them in my services, they think that these are not their responsibilities, and when they treated to child protective services, also they don't follow up in these cases to know what's happened to them later in their life. Disruptive and neurodevelopmental cause children to adopt to a persistent fear state, and this is really a precipitating factor for hypervegetative state, anxiety, and behavioral impulsive, and will result in psychopathic personality. Of course, once again, the emergency room surgeon, they will not take this in their consideration. Will you imagine that hypertension is a result of a child abuse? Now you will start thinking. The study to prove it an indirect way, and this is a scientific fact and published. Of course, not every hypertensive patient is abused in his childhood, but adults who experience abuse and neglect during the childhood are more likely to suffer from cardiovascular disease, lung and liver disease, hypertension, diabetes, asthma, and obesity. And the reference of the study, you can see it here, and you can get it when you download the presentation. Once again, you will start laughing, but you should not. I put this slide to remember again the score, each one of them: physical, psychological, sexual, emotional neglect, physical neglect, and the household risk factors: addiction, death of one of the parents, psychosis of one of the parents, violence against mother, and one of the parents in a prison. If we get these scores, they are 10. If you get the ACE study, if you have 4 score out of the 10, which I just show you, if you have 4 of them, the risk of smoking will go to 60% compared to if there is no risk factors, you are taking about 40%. So there is increased risk if the child is, if the human being is abused when when he was a child, the risk increased from 40% to smoking. Physical activity, it increased little bit. Severe obesity also increased with the increased score more than 4, and the breast effect also increased, and anxiety increased. All these are related to hypertension and cardiovascular disease. Smoking, physical inactivity, severe obesity, depression, and anxiety all are related to hypertension and to cardiovascular disease. So you should not laugh when you hear that child abuse is a risk factors of adult hypertension. It is well documented. It is not directly related, but child abuse will increase the smoking, decrease physical or increase physical inactivity, and so on, which all of these will result in cardiovascular disease. One study shows that children who experience neglect were an increased risk of diabetes and poor lung function. And this, you see the reference. You can get the reference and review the study. Child maltreatment has been shown to increase adolescent obesity, and here we are talking again about all the diseases that are related to adolescent obesity. Immediate emotional effect of abuse and neglect in child: isolation, fear, and inability to thrive. Here we are talking what happens to the child immediately after he is subjected to abuse: isolation, fear, and inability to trust others. This will translate into lifelong psychological consequences, including low self-esteem, depression, relationship difficulties. Researchers have identified link between child abuse and neglect and the following: difficulty during infancy, poor mental and emotional health, cognitive difficulties, social difficulties, and I will go quickly through them. Emotional difficulties during infancy. We are talking that what happened to the psychology of the infant after being subjected to the child. Of children entering the child protection services in 2010, 16% were younger than 1 year. The primary caregiver change negatively affect their attachment. They were attached to the maybe abuser or not to the mother. Not when they are taken to the child care services, they will get another attachment, and this had a negative effect on the child. Nearly half of the abused infant in child protective services exhibit some form of cognitive delay, have lower IQ scores, language difficulties, and neonatal challenges compared to children who not have been abused. And this is also a well-documented study. Poor mental health. So it affects the emotional consequences is in infancy. Later on in life, they will have behavioral disorders, depression, anxiety, other psychiatric disorders, all related to a childhood abuse and neglect. The ACE data found that roughly 54% of cases of depression and 58% of suicide attempts in women were connected to adverse childhood experiences. And this is really, when you are talking about psychiatry, this is a lot of load of cases because those patients were abused in their childhood. Of course, the psychiatrist will not be able to do anything at this time except treating the patients and try to prevent further abuse if he is interested in the social services. And I'm not really optimistic about this. Many psychiatric doctors, not only in our country or in our region, they just want to finish the case, giving the antidepressants and get the patient out of the room, and they don't forget about the public health issue and trying to prevent other children. Child maltreatment also negatively impact the development and emotional regulation. It continues with the abused child from childhood to the adulthood, and also this another important issue. When talking about depression, we go back to the tennis score. If they are more than 4, you see high expression demonstrated very well in the ACE study. And suicide attack, if you are +4 scores from, which I said that you need to remember the tennis scores, there will be increase to 20%. And we continue with this with all other psychological conditions, mainly the cognitive one and achievement and the schools. And probably I will finish with this one. More than 10% of the school age children and youth showed some risk of cognitive problem or lower academic achievement. One of the important numbers, 43% of abused children have emotional and behavioral problem. And after abuse of the school period, 13% has both. When we talk about social consequences, we go into public health, the effect of leaving work of those patients who were abused at their childhood. And the last slide will be the effect on the society. Probably this is, I'm really sorry for time, but I should not miss this one. Delinquency, bad sexual behavior, abortion, committing the crime, adolescents, misconduct, all these are related to child abuse, and you might expect this will affect the effort of the Ministry of Finance in dealing with this issue, and Ministry of Health when we are talking about a lot of these issues that we are dealing in our adult life that are rooted in child period. So when we are talking about consequences of the child abuse of the child and the growth, we are talking a much wider issue that will end in the health of the adult, in the public health issues related to the government and the suffering at the level of the psychiatric services and psychological services and the protection services. Of course, the main message I gave at the beginning, which I think the most important one, is the 10 factors in childhood we should work on prevention so to avoid these consequences. Can I go to? I can share now.
Yes, sir, you can.
Yes, I want to let you know that this site, www.jahshan.com, is an extensive, unfortunately, most of it is in Arabic, but the references that I mentioned in this slide, you can be downloaded easily. And of course, you can download this presentation without the clinical cases and the pathology cases. I will remove them, and I will put all the presentation at the first link when you open this site, jahshan.com. I was pleased to be with you and thank everybody. Yeah, thank you. Any questions?
Yeah. So I have one question from Professor Goria, and the question is, what are your experiences of child abuse in schools, and which abuse is more harmful in school, physical or psychological?
Well, of course, yeah, child protection services in Jordan, Bahrain, and in India, I think, are all related to cases reported by police and cases reported from emergency room hospitals, which mainly that happened at home. Unfortunately, I know about culture, I don't know about India. We are missing very important service at the schools, which is the health service, which is supposed to be able to screen cases for abuse and reported them to child abuse services. In schools, we are all the three third world countries are much behind than what expected. Psychological abuse in our countries are very much prevalent. You saw its consequences, but it is considered part of teaching, and it is accepted even by the parents that a child may hit, the teacher may hit a child, and considered part of the teaching tools. Of course, this is not accepted anymore. We are against corporal punishment completely. Sexual abuse is very rare inside the schools in our culture. I don't know about India, frankly, but sexual abuse in the way to school for those who are going walking or going back from school to home is still a real problem. Well, of course, when we are talking about bullying in school, this is a huge issue, and sometimes it's not classified as child abuse, and it needs a special program. But to me, it is a kind of violence against children, which the response we expected that the Ministry of Education and the Ministry of Social Development and Health that need to deal with bullying in the school, because it is one of the major factors of violence and the crimes when they are grown up.
Yeah. Next question we have, can you tell about verbal abuse and its effect on child?
Verbal abuse, what I meant by verbal, I don't have a special definition of verbal abuse. Verbal abuse is a tool of psychological abuse. So it's just, it is not a different entity. And if we go into trying to differentiating between emotional abuse and psychological abuse, me, I tried and I failed. I don't expect anybody will differentiate between emotional and psychological abuse. To me, verbal abuse is a form of psychological abuse and not emotional neglect. Just to clarify, neglect will be completely negative. But if you use a bad words against the child, you are psychologically abusing him.
Next question we have, what affect the most on a child after being rescued? How intense is the recovery process?
Oh, this is, that's need a lecture next week. It's, this is very challenging. It's variable. As I mentioned in my presentation, the effect on the child is variable. And the services that are provided to the child are variable from the capital compared to the district services. All these factors will affect the result of the treatment. So if you measure the success of a child protection services, it good theoretical standards, but are they applicable or not? Most of the time they are not. It should be multidisciplinary. It should be multi-sectorial. It should be culturally sensitive. It should be child-centered, and it should be culturally centered. And to measure all these variables is really difficult. When you design a child protective services, it should be accompanied by a program of awareness, and also it should be easily accessible. Without applying all these results, you cannot guarantee the cure of the abused child. So if you are telling me,
And as we are reaching to the
any
towards
service in the whole world,
I'm taking the last question. Could bedwetting and the anger in a child be due to any childhood trauma? I think we have lost the connection of our esteemed speaker due to some technical issue, and I cannot find him in the room. So if he's joining, Priya, you can take his into the room. In the meantime, I would like to all the participants for being a so patient listener, but due to some technical issue, our voice is less, but you can watch this session by revising onto our YouTube channel, that is a Forensic 365. You can get a complete presentation from there, and you can download that presentation from there also. And with this, I would like to present a speaker of to speak certificate to our esteemed speaker, Dr. Hani Jahshan. Sir is not in the room. Once he will come into the room, we'll kindly request him again to accept this certificate. With this, I thank you, my team, also for making a continuous effort on the social media to reaching maximum people so that they can get benefited by the lectures delivered by the international speakers. Thank you, my team, for your dedication. And for this, I like to present one certificate of appreciation to everyone. I request my team member Afrin Tarannum, Amala K. Raz, Kesas, Amber, Anmol, Dr. Janita, Dr. Pooja, Falak Khan, Kanheri, Kartika Mishra, Lakshya, Lashika, Mabel, Neha, Nimisha, Pallavi, Priya, Raj Vignesh, Ruchika, Saza, Shivani, Tahir, Tanya, Vaishnavi to accept this certificate. With this, all the registered participant can download your certificate from our website. And the website name is, I think we have got our esteemed speaker. Sir, can you hear us?
yeah, I can hear you now. Yes.
Yes, sir. So with this, I request you to kindly accept 1 second. We gone far. So I request you to kindly accept the certificate of appreciation for delivering a wonderful lecture on behalf of Sherlock Institute of Forensic Science. Thank you for taking out time for delivering a lecture. And you are not in the room, so I requested my team member also. I thanks my whole team members so that they can reach more and more people. And with this, I request all the participants, those who have registered on our website, you have to just click on the website forensicevents.com and click on this pink button, that is a download certificate. After clicking, you will find this window, and here you can enter your email address. By entering email address, you will find your certificate for the download, and you can download your certificate. If you are trying this download from the mobile, you have to scroll down and find this download button, and you can access your certificate. With this kind of certificate, all the participants will get signed by Dr. Hani Jahshan and by me. And with this, I want Sir to give the conclusive remarks. Dr. Hani Jahshan, over to you, sir. Sir, I want you to give the concluding remarks.
Will you say again? Oh, thank you.
Yes. Thank you, sir.
Sir.
Yeah, I'm really privileged.
Thank you, sir.
Yeah, thank you.
And,
I'm really privileged that I participated in this presentation. Of course, India became part of my professional career, and I thank you very much, and I thank the participants. I'm really glad that 100 participants are there, and I learned a lot, and I will be ready to communicate with all of you. I hope that we will be able to fly again to visit you in India.
Sure, definitely.
Thank you very much.
And it's been a 13 months we last met in India, in Lucknow. So with this, I like to announce our next lecture. That is the topic is the basics of the biological profile in forensic anthropology by William Welcher, and the instructor will be Dr. Pooja Chakravarti. So you all can attend this session on 13 September. Soon we will share the link of registration on our social media platform. You can visit our website, forensicevents.com. You will find the registration link over there. And in September 2021, we are going to organize the first international biennial symposium on, of Association of Forensic Odontology for Human Rights. And in this, I would request Dr. Hani Jahshan also to be a part in the Mumbai in September 2021. With this, I thank you everyone for attending the session, and I am handing over session to my co-host Priya. Priya, over to you. Priya, you are in the room.
Bye, everybody. Thank you.
Thank you, sir.
Thanks.
Hello. Sir,
Yes.
I'm audible.
Yes, Priya, go ahead.